My name is Shahina Braganza and I am an emergency physician at Gold Coast Health. Back in 2002, it was my first year here at Gold Coast Hospital, and 10 months in, I had an experience that I now recognize to have been burnout. I'd just been working very hard, relentlessly, shift after shift. And of course, I was enjoying myself, but in an unexpected fashion, that fatigue just accumulated over time. I am grateful to my boss who encouraged me to take a break. And the poignant thing that he said to me one of the times we met was that one day I would do something really useful with this. And so roughly maybe 12 or 13 years later, I was in a role here at the hospital of Director of Clinical Training. And that's probably when that interest and passion for me was able to crystallize when I was looking after the junior doctor cohort here. And I was able to translate that experience into something that was able to be delivered to our staff and to our junior doctors. Healthcare workers suffer all of the mental health challenges as the general population, but in a disproportionate amount and a disproportionate way. So depression, anxiety, insomnia, even eating disorders occur at a far greater rate in healthcare workers than in the general population. Doctors and medical students experience not just psychological distress, but suicidal ideation to a level that is 4 times that of the general population. And I think that really triggered thinking and conversations around what it is that's going on, not just in doctors, but in all clinicians. The 1ED program we initiated in 2016. Our aim has been simply to try to normalize the conversation. In generations gone by, it was considered an uncomfortable thing to do, to experience distress, let alone have a conversation about it. There was a thought that if you said that you were struggling, maybe you would be seen as not being cut out for this or being not fit for this. Whereas hopefully what we've managed to shift very slowly over time is that those experiences are completely normal. We are connected with the universities, and I deliver a couple of specialist lectures to the university students. But what I hope is that it plants a seed and it sits somewhere in the recesses of their mind. And hopefully what they most remember is that if they do struggle along the way, that is a normal thing and that they're then encouraged to talk to someone about it. So as clinicians here on the ground, delivering frontline care, it is wonderful to be able to be surrounded by other like-minded people who are basically broadening the work that we're doing beyond just the patient contact. Why the Gold Coast? I think the next stage in our evolution as a city is to become the smart city. There is more than beauty here. There is a lot of brain as well. And I'd love to be able to see that harnessed in a way that really leverages all of those aspects of what makes living and working in a place an awesome experience.